I am very pleased, and I mentioned her before, to have the moderator, Catherine Gretzinger, here today. Catherine is an associate professor teaching the School of Journalism, Writing, and Media at UBC. She's a longtime public broadcaster at CBC with many local and national awards. Catherine was also named one of North America's top innovative journalism educators in the year 2018. There is a strong social justice undercurrent to all of Catherine's work. Her commitment to teaching, to reporting, and fostering dialogue about social justice issues, Indigenous relations, and mental health appear both in the courses that she teaches, as well as her key collaborations, including her work with UBC's Mental Health and Wellness Community of Practice. I am very honored and very pleased to introduce you to Catherine Gretzinger. Catherine.
Hi. Thank you very much for sparing us your Saturday afternoon to join us to learn more about mental illness and the difficulty that those with mental illness have with the system. As a family member, I know how hard I have to struggle to help my daughter get the services that she needs. So I just stepped down as the president of Pathways, having served my 6 years on the board. So now I'm the immediate past president. So I guess that was false billing on my part. It's been a journey. Pathways has been, Serious Mental Illness Society has been at my side since 2012, offering education and support and lots of help with the system, good advice, and as I made my journey with my daughter for these past 12 years, because her diagnosis was in 2012. I've been an advocate, I guess, for more than 50 years on various issues, but the last 12 years has been to serve as an advocate for my daughter. Once I learned a bit more and how to accept her illness, to learn how to support her, learn how to talk to her when she's frightened, or because if you say the wrong thing, it'll make them angry and reactive. So it's a bit tricky. I'm just grateful that I lost her for a little while, for about 6 months, and had to look for her during the pandemic in the downtown east side with the help of a friend who calls herself the mother of my daughter's heart. And we found her in a small tent in Strathcona Park. She was known during the pandemic as someone who lived on the steps of the Carnegie Center and in the smallest tent. Because, you couldn't go indoors for the price of a meal or a cup of coffee. Everything was closed. All the community centers, all the restaurants, all the libraries, all the communities, everything was closed. And there was nowhere you could get warm, and it was our coldest winter. Do you remember how cold it was? Then the summer was the heat dome. That was her 9 months spent on the streets of Vancouver. Anyway, so that's a long enough self-intro, I guess. I better pass the microphone. Thank you.
And now Catherine is here. So as I said before, I'm just greatly honored to be able to introduce the moderator and the facilitator of this panel, Catherine Gretzinger. So I'm going to pass the microphone over to Catherine. Just honestly, Catherine is just an award-winning journalist, and I'm just so grateful that she's here. So over to Catherine. Huge round of applause for her.
Thank you. I thought we had a couple of seconds, so I had to step backstage for a moment. I apologize. Shirley. Hi. Lovely to see you. So nice to see you. Thank you all for agreeing to join the panel today. And I don't know how far you got. You just have done your introduction?
Stole the whole time.
Okay. Bill, do you want to go next and just offer a brief introduction? And I am going to have each of you just talk for a moment and share a couple of reflections on what we've seen of the film so far. Bill.
Yeah, so I'm professor at UBC, the Jack Bell Chair, as was mentioned. I'm a psychiatrist. I largely do clinical consultation work in the BC Psychosis program, which is housed out at Detweiler. And I think that, it was tremendously moving, and I hope we have enough time to sort of try and pick up the mood of it, because that was really hard and really difficult to learn about some of the things that people have been going through. So I hope we have a chance to try and lighten things a little bit.
Thanks, Bill. Jack?
Yeah, thank you so much. I'm Jack Middleton. I'm the president of the BC Schizophrenia Society. I've been with the board for about 4 years and the president for 2. I joined the organization because of my friend Abdella. I grew up in southern Alberta. He was diagnosed when we were 20. And at the time I found it very isolating, and his family was very isolated as well. But I think the types of organizations like BCSS and the type of things that we saw in the film are the commonness of this. The stat that Phaedra gave of 1.8%, the commonness of this, it's something that I think talking about it and putting it out there really allows us to have these tough conversations, but it allows us to bring it into the light, and that's really important.
Thank you. David, this really centers in your family. Thank you ever so much for being here. I'll invite you to introduce yourself as well.
Yes, I am David Hiltu, the star of the show, obviously. But they cut out my final scene, so.
I have it right here. I have a quote from your final scene.
Oh, there you go.
Go ahead.
Anyway, I've seen the movie twice. It was first premiered in Calgary, and I did a panel similar to this. And I'm not sure why this time affected me more, but the first time I think is because I was just watching myself like I'm in a movie. It's like what are my scenes? And you look at yourself and go, ooh. So I think, but this time sort of affected me more. And Wendy wanted me to come here and the Schizophrenia Society to give a personal view. I talked to Wendy earlier, and I said, remind me why you made the movie. And you would think it's because it's Bruce. And the point of the movie is for empathy. These are real people that are loved. But she made a movie, Nowhere to Go, about 40 years ago. And then she looks at the scene today, and it's like, how could it be worse? So what struck me from what she said is she didn't make it out of compassion. She made it out of anger. Like, this is insane. And that's the title, which is kind of brilliant, I think. So anyway, thank you. And thanks for coming, everyone.
I'll give you one of your quotes back to you, and then we'll launch into talking about the point of the film. The quote that grabbed me when I watched it last night: "They are worthy people. They deserve a better life."
Yeah, and I think I mentioned in the film how he was the best and the brightest, and he really was. And they talk about IQ, and it's not just intellect. So he read encyclopedias when he was younger, and they had him assessed, and they assessed his IQ at 160. And my parents did not tell him. My mother's like, no, you can't tell him that. That's going to ruin his life. So he was quite smart, and also his emotional intelligence. He was very sensitive to other people. Even when he taught me to drive, it's like, what do you think that car's thinking? Do you think he wants to be in his lane? And what is this person thinking? And also, I remember when I was younger, and I think I was like in grade 7 or something, and I was walking with Bruce from the store past the bus stop, and we were talking, and I was just sort of, I don't know why, excited about something, waving my arms around. And he said, did you see that lady on the bus stop? I go, no, I didn't really notice her. I go, well, she was kind of afraid of us. So you should have toned it down a bit. He's always very sensitive to other people.
And clearly had such a profound effect on you, your siblings, your parents, that the specificity of him and trying to hold on to that. What's it like to sort of see his story shared in this way, that most private story that you all know, and then to share it in this public setting?
I'm quite proud of my family when I'm seeing this. So, and he was very loved, and everybody cared about him a lot. And yet, like other people in the film, like Shirley's, there's nothing we can do. It's not hopeless, but it's just very sad that even from a really good family and people care and try to help him and petition for him and everything, and still it didn't really help in the long run.
Thank you. Shirley, the idea that you, as this very outspoken Vancouverite, has not been able to access the services of Car 87, which you're supposed to be able to access, that one really stuck for me. What do you see in this film? What is sticking out for you as you consider the story that's been told here?
I think what really stuck is that we have a lot of police, but we don't have a lot of health services that are accessible when people need it. And, you know, one of the things that I'm grateful for in British Columbia is that the BC Mental Health Act does allow us to treat, to assess, and to hold. Okay, one doctor can only hold you for 48 hours. But if you get two, you can actually hold them for longer, for 2 weeks, 3 weeks, right? And then if they deem, and they can treat you, because, you know, in Ontario, you can be hospitalized and then not get treatment because they deem that you have the right to choose. And if they think you have the right to choose, you can be locked behind hospital doors for years at a time without treatment. And the psychosis, which does so much cognitive damage to the person who's suffering psychosis, it doesn't get treated. You don't get healed. The damage is much worse. So those are all areas of concern for me. And the Car 87, we always got the police. We sometimes got 4 police all at once. We just never got a social worker or a psych nurse along, and they don't have the capacity to diagnose. They don't have the capacity to assess whether or not you need to go to hospital, but they can decide to arrest you if they think you're not behaving or not responding to orders that are being given. So having more Car 87s, more funding for that. And you know, the good news is my daughter is currently at a healing center called Redfish out in Coquitlam, where she's their model patient. She goes out, she's no problems, there's no relapses, she gets 4-hour passes to go out 3 times a week all on her own, and she comes back after she takes the bus or the SkyTrain. It is possible to make the journey to where they are ready to heal and be healed, but we only got access to Redfish, which is a 6-month wait list, because the psychiatrist at the hospital talked to me twice a week, and her ACT team psychiatrist talked to me, and together they said, we can't just discharge her back to the community and to her apartment where she's going to relapse. We need to get her into Redfish now. And the following week, she was in. So if you can get that advocacy, that's what you need. But everybody needs that access.
All the time.
All the time.
Bill, as somebody who works within the system and has done for an awfully long time, watching a film like this, what's going through your mind as you take on board the stories that we just shared today?
Well, I think what came to my mind, you know, is how much variability there is actually in people with schizophrenia. Some of our patients on the ward, you know, do really well actually, you know, and again, I guess you don't make a movie, but the ones necessarily who do really well. But and so there really definitely are, you know, no question, those who don't do so well. So if I consider, you know, some of the things about family support, some of those who don't do well, it's because their families don't know how to help. And oftentimes that's because they don't understand the illness. They may in the family not, you know, believe there's the illness or that the medications can help with the illness and so on. So I think just for all of you here who are obviously engaged with the society, and the reason you're here is maybe to learn more about the illness or those kind of things, don't give up on it. It does make a difference. All the things you do, you can do, and perhaps could help others in families where they have not yet got the kind of understanding of things that you might have that have been helpful. And it really, there's reason for optimism and hope on these things. And in some ways, I think maybe even more that we can do as family members and treating, you know, on the front line clinicians and so on. The system is something else again, and I don't mean to represent the system directly at all, because I have my problems with it too, believe me. So thank you, Catherine.
Yeah, we're not focusing on the system today because, yeah, we'd be here for a lot longer, no doubt. Thinking about families and all of the work that you do at the Society and watching this film through that lens, what's going through your mind, Jack, today?
Yeah, I'm an optimist as well. I think it's really important that we all are, and I don't want to speak for me at the BCSS because the BCSS is all of the people who do the hard work all over the province. We have educators in every region, and I think that system advocacy and that work that they do, and that our educators help train people to do so they can advocate for their loved ones. That's so important and so critical. And yeah, there's bad examples, and it's scary, but I think it's so fundamentally important that an organization like BCSS continues to do that work around the province.
Families often talk about how they know their people the best, and they want to do right by their people to provide care. And as we heard from the mother on the screen, she's never going to stop advocating. I have very dear friends, a couple of them are probably in this room today, who have children who they consistently advocate for, and they butt up against a system that is rigid. So how do we make a system that respects the privacy of the person who's in the crisis and respects and includes the loving family that is there to help and defers to the medical help and supervision that is required to provide the care? How do we do that in a way that is going to be able to juggle all these balls? I'm looking at you and you're going, don't ask me. Don't ask me.
Yeah, no, I won't fix the system here on stage in the next 2 minutes with this answer, but I think finding opportunities to include families in notification about when people go into the system, when they come out, I think there's a really good private members bill that's been put forward. There's things like that are critical, and I think at BCSS, we advocate for family involvement in care at every stage, and that's really important. So, yeah, Shirley.
Shirley, jump in.
Often the professionals think that the FIPA, the Freedom of Information and Privacy Act, prevents them from sharing information. But it doesn't, because there is a clause that allows you, because you have the right to know or you are the community support for your loved one, that will permit them to share information with you. But even those, we always say document. You need to write down, your family member and your loved one best. You share that, even if they don't share information with you, you share it with them so that they can at least take what you know and put it into their, they know, what the baseline is this for your loved one. You know what well looks like to you, and you know what sick looks like to you. And you can share that information if they will take it into account, because not all doctors, psychiatrists, nurses will. And I've had a whole range of different responses from the medical practitioners. And the ones who will respond, who do listen, who have some compassion, empathy, and kindness, makes all the difference to the experience that family and patients have. So,
such an important point. Go ahead, Bill.
I mean, from a medical doctor's perspective, a patient is a person who has an illness. And doctors, we understand the illnesses. People grow up in families. You understand the family understands the person best. And so, and becoming educated, you also understand something about the illness. Understanding what part of behavior or thinking and so on is the person and what is the illness. That's really what's important. And where you know the most about the person and so on, being able to help, and for doctors or other healthcare providers, helping them understand the person and so that they can help with the illness, and knowing those two parts of it, I think are really important. And that's a role that you can help with in advocacy, as well as with individuals or with other families, to get that clear in people's minds. What's the person and what's the illness? Is the person talking or is this the illness talking? It's really important to understand those things.
I'm very aware of time. The theater needs us to be gone a little bit sooner than we were thinking. So I would like each of you to make a comment on if you could fix one thing about the system with regard to families and patients, people living with these illnesses. What would you fix? What would you fix first? Go ahead.
Wow. I'm not really sure because I'm like 40 years out of experience. Like the Bruce thing is like 40 years old and all the medications were different. I wasn't going to talk about the medications or what we had to go. He was talking about interaction. And we had one really good doctor that would say, how's he doing and what's he doing? And then the next one was, well, I'm the psychiatrist, so I'm going to give him this drug instead and not ask, like, how is he reacting to it? Back in the day, it was lithium and really these crude things. I was talking to the AbbVie rep and the thing. It's like, what are the medications like now? Because I'm kind of out of date. But it's just, like the movie says, like, intervene sooner, and it's cheaper. And don't be judgmental. It's just like, we need to do this to help people.
Thank you. Go ahead, Jack.
Yeah, accessibility of treatment is something that I think is just fundamental. And I understand that there's a whole lot of barriers to having people be able to get in to see a psychiatrist and to do that work. But, you know, if it's making more accessible blood testing for drugs like clozapine and things like that, there's a whole host of things that can happen, but that accessibility is fundamental.
Okay, great, thanks.
So I am a professor and the thing of a certain age, and the things that worry me actually that I hope that we would make a difference are being very careful to make sure that the education of our future physicians and psychiatrists is up to a good standard, and that we continue to support research to understand more about the nature of the problems that our patients have and how we might intervene more effectively. Those are things I'd like to see change because I worry about that. It keeps me up some nights.
Trying not to repeat everybody else, because I agree access to treatment is critical. It's to ensure that we know families have hope if the system will support their engagement and their inclusion in the whole treatment journey. So yeah, more money is great. Access when you need it would be ideal. And I know that lots more wraparound services like the ACT team provides will make a big difference. Thank you.
And we still need to do a hell of a lot of work on stigma, talking about this more openly and being much more inclusive about the ways in which we talk about people who are involved in the system. Thank you all so much. Sorry, we just scratched the surface. I want to thank you all for coming out on a Saturday afternoon in Vancouver to participate and support this film. And to Phaedra and to Kendra sitting here quietly in the front row who took such good care of all of us getting this ready. Thank you very much.
And Catherine, I completely agree. We have just scratched the surface. We could have spent hours on this panelist. I have so many questions and so many thoughts, and I know Catherine would as well. But David, Jack, Dr. Honer, and Shirley, thank you so much for being here. Thanks so much for your presence. David, I was really touched by your vulnerability, and I think it's important that we show that. You know, as I always say, emotion is not a bad thing. And Dr. Honer, as you said, there is optimism, there is hope. And I think we have to remember that. But I think we also have to appreciate the realness and acknowledge that. And David, so thank you for being here and for showing that today. And Catherine, thank you so much for facilitating, and for Shirley for your ongoing advocacy. And to each of you, as we said, it takes all of us. And that's the only way we are going to make change. So let's continue to ask those questions. Let's continue to ask for help. Let's continue to get involved. And let's continue advocating not only for our loved ones on an individual level, but find ways that we can get more involved at that system level and ways that we can have that stronger and more united voice. And I'm very grateful for Wendy for creating this film. And yeah, if you do want to watch this panel discussion, there will be a professional recording of it. Unfortunately, we can't show the film, but if you'd like more information about the film, we could put you in touch with the director to be able to watch that. And a reminder about becoming a member, please become a member of BCSS. It's free, and it just, as I said, it strengthens our voice together. And if you'd like any more information on BCSS, we're on the website, we're on social media, we have a podcast, there's lots of ways to get information. And I just want to thank AbbVie again for being the event sponsor of this. So thank you, would not have been possible without your support. And a big thank you to you as family members and caregivers and friends of those living with severe and persistent mental illness. I know it is not easy. I know it's not. So thank you for continuing to advocate. And just remember that BCSS is here to walk with you, and we will support you across this province as much as we can. We have an amazing team, and we are willing to wrap our arms around you and help you and support you as best we can. And as Dr. Fuller-Torrey said, compassion follows understanding. It is therefore incumbent upon us to understand as best we can. The burden of disease will then become lighter for us all. Thank you so much for being here. Thank you. Please take care of yourself, and we will be in touch soon. Thank you.